Your mucus plug just fell out. First off, what the heck is a mucus plug? Also, what does it mean? What is it like? Are you having your baby right away? Should you just head into labor and delivery? Today, I'm going to give you all the answers about the mucus plug that you absolutely do not want to know. There is no one looking this up who is not pregnant. Am I right? Tell me down in the comments if you're a little bit sad that you're even watching this, but I'm glad that you're here because this is a misunderstood thing in pregnancy. Okay, so this is your pelvis. You've got a baby in there, you've got a uterus, and then this is your pelvis, and it may feel crocheted at this point in time. But we're mostly talking about our friend, the uterus right here. So your mucus plug is created to basically put a little cork at the bottom of your uterus so stuff can't get up there to baby. Because if bacteria were to get up into baby and into the uterine area, that can be really problematic for both you and baby. And if you're wondering more about that, it's called chorioamnionitis. And obviously we don't want bacteria getting in the way of your baby's growth and progression in the womb. Now, if you're early on and you've lost your mucus plug, by the way, if you're early on and you think you've lost your mucus plug, I would call your provider because it could be a sign of preterm labor. But the good news is it can actually regenerate, like it can regrow. There's like some negative pressure that like gets all the things that are in that area, including mucus, blood cells, just old skin cells, and it creates this cork or mucus plug at the bottom of your uterus. So the bottom of your uterus is called the cervix. It is the end of the uterus, although is part of the uterus. And it is what we check when we see how dilated you are, in case you're wondering what the heck the cervix is. So for this one, he's like 4, maybe 5. I feel like this guy's getting stretched out. But as you can imagine, if there's a cork right in here and this thing starts to open up, plus you've got gravity because gravity would be pulling on the cork as well, the cork can fall out, the cork being, of course, your mucus plug. So usually when your mucus plug falls out, it shows us that this is starting to open up or at least soften. I like to think of it as if you had a bottle of wine upside down and the rim of that bottle of wine was starting to soften and open up. The bottle of wine's upside down. As you can imagine, at some point, the cork would fall out, right? Luckily, our baby is not just going to fall out like all the wine would. Some of you might be wondering, how do I know? Because I've had some changes in discharge. I'm here to tell you that I only saw the mucus plug on one of my babies, and I just think you'll know. You might just want to fast forward a little bit, but it's a little bit chunkier. It's a little bit thicker than usual discharge. I would use the word chunky. It looks a little bit more like thick jelly than like discharge. Again, please like this video because I'm obviously bringing my very best to this one. Now, sometimes it's really confusing as to what you should be doing when you're having these signs of maybe early labor, but not really contracting. I think it can also be a little bit scary, which is why in the online prenatal class for couples, we have a whole video that talks about early labor, laboring at home, so that you can be prepared to labor at home and feel confident about staying at home until you're in active labor. So if your mucus plug falls out, does it mean you're in labor? Should you just pack your bag, head on into the hospital? I'm here to tell you that people have 100% showed up and just told me, I lost my mucus plug, so I think I needed to come into the hospital. And I'm here to tell you that your mucus plug is a sign that maybe something is happening, especially if you're losing it, once you're past 37 weeks. However, it probably means something's going to happen in the next week. And like I said before, it may regenerate or just chill out and hang out and absolutely nothing happens. But I will say that a lot of times before people go into labor, I hear that their mucus plug fell out a day or two, usually like within the week of them having their baby. However, I've had 3 babies. I've only seen the mucus plug once. So if you're like, I haven't seen my mucus plug, I'm clearly not going into labor, I am here to tell you that you can still go into spontaneous labor, which is what I had with both of those babies, without ever seeing your mucus plug. In fact, I think a lot of people maybe just wipe it while you're busy. I bet I wiped it while I was busy at work one day and never saw it because usually it comes out in the toilet when you wipe. So unless you're like inspecting everything after you do your business, you might miss it. And frankly, not a big loss. Okay, the other question, do you need to take a picture or bring it into labor and delivery? And I'm here to say, no, I believe you. If you tell me your mucus plug fell out, I'm like, cool, great. let's move on. Honestly, it just tells me maybe your cervix is softening a little bit, but chances are if you're coming in to see me in the hospital, I'm probably going to want to check your cervix and see if it's opening and what we should be doing for you moving forward. And if you're saying, Hillary, what on earth could a cervical exam tell me? I'm going to leave a post about cervical exams. I'll leave the link right up above and down below.